Welcome to the Absite Smackdown podcast. We'll talk clinical scenarios, Absite facts, and interesting general surgery knowledge. Now, let's get to it.
Hey guys, welcome back. It's me, Jess, your host of Absite Smackdown podcast. With me as always, Dr. David Kashmir, and one of my favorite guests, Dr. Rhonda Barsoon. How are you guys doing?
Great. Happy to be here.
Jessica, I'm doing great. I'm really glad the conference got wrapped up. So life is good. I'm feet up on the beach, but not really because I'm in my office with books, but feet up on the beach in my mind.
Okay, I was going to say, I'm pretty sure you're in your studio right now, but in your head, if you're at the beach, then I'm super supportive of that. Speaking of the beach, pretty sure Dr. Colton Lee is on vacation this week. I think that's what he said to me, but I am so happy to have another female, especially one that rocked the conference so hard. She did 2 lectures. They were fantastic. She kept such great pace. And that was one of the, a lot of the feedback that we got, because if you guys were at the conference or if you weren't, we had a little QR code where you could scan it and give us feedback about the conference. And one of the things that we got back that was awesome for Dr. Rhonda was that her pace was really good. And that, you know, everybody felt like she went through a really good question. So compliments to you, doctor.
Very much. I was thrilled to be participating in the conference, actually, and I had a really good time, and I certainly learned a lot.
What do you feel like? I know, just like, okay, so one of the things that was not difficult, but what we made to overcome the difficulties with this conference was the fact that you guys are busy doctors, you're on call, you're in and out. And so going to a conference isn't always feasible. This way, being online, not only was it online, but it was being recorded. So if you took a call, if you had to leave, if you were in surgery, you're able to just come back. And I know a lot of people, I'm pretty sure you were on call that weekend and still managed to present twice. So that was pretty amazing.
I was on call both Saturday and Sunday. So yeah, I mean, I managed to present, but at the same time, I actually felt comfortable knowing that all these talks were being recorded. So specifically talks that I know I struggle with the most, I know I can go back, and even though I didn't get the whole talk or was able to listen live, I can go back and listen to all those talks again.
Mm-hmm. That's awesome. Dr. K, what was your favorite part of this?
I really appreciated you guys inviting me to help out. I always do. I like that it was based on the review book. So we kind of had a unified source for it. The most interesting part to me was some of the statistics you sent after. I think you said the total was 248 participants. It was across 5 time zones, and the furthest person away was in Australia, which was really cool. And, it was, I think, 14 speakers, including myself. Just a great round of how to do something like this when you have COVID and other barriers to getting there. I always wanted a conference when I was a resident. I could never get to an Absite conference because I was on call or something. So just the way you guys have maintained kind of the mission for this stuff, to help people out, to give away all the free content, now to have a live review course because some people wanted that. It's really great to see.
Well, I mean, I hope people found it useful. It's perfect because, we're just about to go into the Absite for that last minute cramming. But because it was so helpful, we decided to do it again. We're going to do it in August because then that gives you plenty of before time for everybody that did not plan, that are leaving this Absite and being like, oh, I should have started earlier. So we're going to help with that, and we're going to help you start on the right foot.
The Absite Smackdown podcast. Visit the Smackdown at absitesmackdown.com.
Yeah, I really like the way you guys try to help people year long and give them easy reminders for what we can do so we're not cramming, and then also how to kind of work the study into their daily routine. So that's great. And the videos, like you said, for this course were still accessible to people who had the tickets. They're still accessible now at the course website, and that's great. And my understanding is you guys gave them access to the full video reviews that go, exactly chapter by chapter as part of their conference participation. So it's just, again, thanks a lot. I think it's really a useful way to help resident staff.
Well, we did do that because, again, the conference was highlights. It was all, it was like a condensed, shortened study version. It was hitting the highlights. And so for those people that need, line by line, that's why we provided that. And Dr. Rhonda, what do you think, speaking of cramming, like, yeah, we're going to have that later on, but it is go time right now. We are cramming. What are you doing right now to cram? Because your test is in 14 days, right? 14 days, exactly 2 weeks.
Reminding me, yes, it's exactly 2 weeks from today.
Yeah.
This is absolutely cram mode, and cram mode usually consists now of not reading line by line, but again going through high yield, just highlights of every topic. So that makes the course even more valuable, because then I can go through the high yield, and then once a topic hits that I say, oh man, I forgot like the details about so-and-so, I can then go back on my own time and read those specific details without reading all the details at once. So these next 2 weeks are all high yield top points of these videos, and actually in the Absite Smackdown book itself, because every time I see something that I need to look up really quick, I know exactly where it is in the book, so I can just leaf through and find it.
That's fantastic.
Yeah, I would just say the other thing that was really good about the conference was how every speaker worked in questions that they did with the group.
Right.
I thought that having it that way and then also broadcast across multiple platforms was nice. So doing questions, I think, this is the time for people at home. Make sure you've done your questions. It does seem to correlate with performance on the Absite. I know Rhonda and all the staff and co-authors pretty much have been saying they do them. And it does seem to correlate when you've gotten through all the content, make sure you're doing your questions. And it was great to see that the speakers all did questions with the group. That was good.
Yeah. And I guess that's a great way to study right now. Just fast forward to the end, get to the questions, go through the questions on each chapter, and you're good to go. So, all right.
Well, I think Jess and Dr. Rhonda, one of the things we try to do on here routinely is do some kind of case together. And that sort of adds, some value to the people who are listening, gives them a reason to tune in. Besides just catching up about Absite Smackdown, they get some direct Absite and board-related content. So, Dr. Barsoom, I appreciate you being willing to go through a case with us. And I think if you don't mind, we'll get to it now. What do you say?
I definitely don't mind at all.
Okay. Well, with that, again, welcome back. You're on call. Lucky you at the United States greatest hospital. Just by every objective measure, seems to be fantastic. But, even at the world's greatest hospital, sometimes there's a test you want or something that you try to get. And even though it's the best, you can't do it. It happens. But this case is one that we hope you can help us out with. There's a 35-year-old guy who was just kind of riding his bike a few days ago and noticed that he kind of had some knee pain and fullness. And sure enough, gets off his bike and over about the day, just starts to feel like there's something wrong with his left lower extremity. And really just about 7-8 hours ago, his foot started to become cold on that left side. He started to have significant pain eventually and tingling. And he thought, he just kind of had a cramp or something to work out, and he didn't. And it got worse and worse. And to help with the pain, he tried to drink it off. He tried to have a bunch of alcohol, kind of falls asleep. Sure enough, it's now 8 hours since he started actually having symptoms, as best you can tell. And he presents to the emergency department with a cold left foot. And there he is for you, Dr. Barsoom. How do you proceed?
Okay, so you've already told me most of the history that I need to know. The last thing I would want to know is, does he have any previous medical problems or any issues, any medications that he's on, anything like that?
No, he's 30-something years old. Let's say, I don't recall even the exact age I get him. Let's say he's 32. He just doesn't see doctors. With COVID and everything, and even without, the waits are so long, and he just doesn't see doctors.
Right. So a cold leg is an emergent situation. This man is probably at risk of losing perfusion completely to that extremity and might end up losing that limb. So we would want to work pretty fast. So obviously, basics become basic. Obtain our IVs, make sure that he can get his fluids. But most importantly, the most important test I would want to order right now is lower extremity bilateral arterial duplex.
I agree that you took a very focused history. I would just add, are there any physical findings you feel like we should have before we go ahead and start his imaging?
Of course. So a focused history for him, like you said, it was already a cold leg, but I would still want to confirm my vasculature. So obtain pulses. If no pulses are palpable, then try to obtain signals using the Doppler, and then also do a neurovascular exam, just sensation and simple motor of that lower extremity. And I would also want to feel his compartments or feel his calves at that point too.
The whole area is at this point very pale, his lower extremity. You're not able to find a good dorsalis pedis pulse or really posterior tibial with Doppler signal or anterior tibial. You're a bit concerned. And again, the extremity is very pale, cold. He does have pain in it now, although he said it's kind of getting maybe a little better, but it hurts like hell. And, he really wishes he hadn't just gone to sleep and drank. And he may even have some demarcation where it looks like his leg is, a relatively normal color, proximal, and then distal seems to be, like we said, very pale. So with that vascular exam in mind, how do you proceed?
The Absite Smackdown podcast, bringing you the best of your Absite review.
So I'm now thinking that he has some kind of thromboembolic event that has clotted off his peripheral vessels, causing this lack of perfusion at a certain level in his leg, probably more proximal than anything.
Okay. And with that in mind, how do you proceed?
With that in mind, I would now like to obtain my imaging, so the arterial duplex of his lower extremity.
Okay. The left lower extremity arterial duplex shows you or demonstrates an approximately 2.1 centimeter ipsilateral ipsilateral popliteal aneurysm. So on that left side, popliteal aneurysm greater than 2 centimeters in this symptomatic patient. How do you proceed?
The Absite Smackdown podcast is based on the best-selling review book, Absite Smackdown, the only Absite review with an entire video review course included. Visit absitesmackdown.com and pick it up today.
So there are two things right now going through my mind. The emergent thing to do right now is to re-establish flow to that extremity. But I also know that popliteal aneurysms are highly associated with other aneurysms throughout the body, whether it's going to be bilateral or also aortic. So I would eventually want to obtain further imaging to isolate those. However, at this time, the appropriate management of his symptomatic aneurysm is actually going to the operating room for an aneurysm resection with a bypass from his SFA, superficial femoral artery, to the distal popliteal artery with exclusion of the aneurysm.
Well, sure enough, fortunately, your ultrasound team is there, and they are able to ultrasound his right popliteal and right lower extremity. They do find a 1.5 centimeter aneurysm on that side. Just as you said, really, he does have a surgical emergency. And I think you've nicely described the kind of standard repair for a popliteal artery aneurysm. Just a few follow-up questions. First, what are your thoughts on what level he may have thrombosed or where the clot may be that you'll be trying to Fogarty out of the artery when you don't think he has signal at any of his lower extremity arteries? Where do you think that clot might be if for sure he doesn't seem to have a dorsalis pedis, anterior, posterior tibial flow? None of them.
So it sounds like the clot would be proximal to the trifurcation. So it would have to be in the popliteal region or distal popliteal artery.
Yeah, and then I would also ask, based on how long it's taken him to get to the hospital after being drunk, are there any adjuncts, and you may have said it and I didn't hear you, but any adjuncts besides the bypass and a likely artery resection, the popliteal aneurysmal resection, are there any additional surgical procedures he'll need while you're in there, given the time course of this issue?
Yes, actually. So given the fact that his symptoms started 8 hours ago, I'm assuming that there has been decreased or lack of flow to his lower extremity for approximately 8 hours, which gives him an increased risk of reperfusion, causing compartment syndrome of his lower extremity. So at this point, I would also like to perform a 2-incision left lower extremity fasciotomy. Really good compartments.
Well, Dr. Barsoom, thanks so much for your help with this difficult case. We'll be prepping him, trying to get him to the OR as soon as we can at even the United States' greatest hospital. Sometimes there's a little bit of a wait. And I completely agree with you. I think you nicely highlighted the bilaterality here. The fact that this is a symptomatic aneurysm, really repair at any size. But, this one was over 2 centimeters. 2 centimeters is typical threshold. And even if there had been no symptoms, or something like fullness, compressive symptoms, those will be other reasons to fix these. This guy showed up with a cold leg. I like that you added the fasciotomy. I think it's a very safe move. I think in this case, when you're at the 8-hour mark, it's pretty unequivocal, but it's always a conservative move when you reestablish flow. Again, vascular surgery, not so common on our boards for general surgery. But more straightforward cases like this, I think, are good to explore because, like you said, it highlights that old, often bilateral and maybe associated with other arterial aneurysm issues with the aorta or femorals, and you can have these other aneurysms associated with it. So this is actually a guy I saw as a resident who had a very similar difficult issue. And it's just kind of interesting at that age. This is clearly not the classic age for a popliteal aneurysm, but sure enough, had it. So with that, have you seen any popliteal aneurysms or anyone with a similar issue in your practice so far?
I absolutely have. Actually, I saw one just a few weeks ago. Similar gentleman. Yeah.
What did you all do with that?
He also had a bypass procedure done in the medial fashion, actually. So he bypassed the SFA to the distal popliteal with exclusion of the aneurysm. But he had come in with only about a couple hours of symptoms, so he did not need a fasciotomy.
Oh, okay, great. Yeah. Well, Jessica, there you have it. Popliteal artery aneurysms, just sort of unusual, but something that we see and can be a real problem. I think Dr. Barsoom kind of coached us through it nicely.
Get more Absite content in your daily routine. Visit us on Instagram at daily.absite.fact, on Facebook at Absite Smackdown, or LinkedIn at Absite Smackdown. And you can catch the podcast on iTunes, Spotify, Stitcher, or any place you listen to your favorites. Don't forget our YouTube channel, Absite Smackdown.
Lots of good study time in there. So, thank you so much, Dr. Randa, for being on here again and for your participation in the conference. Also, just, being an author on the book and all the things that you do for us here at Absite Smackdown. We're so happy to have you back on. Dr. K, as always, the person that holds us all up to make sure that we all can get this done. Without you, none of us would be here. So just to wrap up, guys, you can still have access to the conference if you attended. We do have one coming up. We're hoping that you're not just cramming now, that you've been studying the whole time, but if not, that some of the things that we provide are going to help you out. And good luck on this upcoming test. Anything else you guys want to add?
I do have a quick question, Jessica, while we have you. I know you all said you're planning to have us do this conference 2 times a year, and I think that's going to be pretty useful. Do you know about when the follow-up, the second conference is going to be this year?
Right. So 6 months from now in August, because I think that, we talk to a lot of the residents, a lot of people, and like when they feel like they need to start really buckling down to study beforehand. And that is kind of like the kickoff time of, if you're doing it the right way, setting up goals for yourself, that's a good time to start. And then, of course, again, we'll do it in January, right before the test, like we just did. So we think having them those 6 months apart is the best way to do it. And that's what we're going to do moving forward.
Okay.
Yeah, I think that's a fantastic idea. I think earlier the studying, the better. Cramming might get you some points, but it doesn't really help with the learning of the actual topic. So, thank you so much for everything that you do and how much effort and work it takes to put on something like this. So I'm truly appreciative of you. Of course, and Dr. K, thank you.
Well, I have to thank Jess too. I mean, I've done it all the time, but I just like being able to participate and get the message out there. I think it's the good work of Jessica, Gianna, Stephen, all the people there. So let's keep doing it. Let's get to the next one.
All right, guys. Well, like we always say, #Absite Smackdown.
Thanks for listening to the Absite Smackdown podcast. Visit us at absitesmackdown.com for more great Absite facts.